seminar this afternoon for bariatric surgery at Cleveland Clinic. My name is Jesse Gutnick, and I'm joined by a great panel today. Dr. Wilson, if you want to wave to the group, as one of our bariatric surgeons on the east side. Karen Schulz is our program coordinator, as well as one of our APRNs, and Jamie Sarver is another one of our coordinators, and has taken a role both as a person who works in our department, but also in particular to tell her own story as a patient. To give everybody an idea of what we're going to go over the next hour, we're going to hear Jamie's story. I'm going to talk about the effectiveness of weight loss surgery, the safety, and we're going to talk about what to expect within our program. And then we'll open up for a Q&A until 5 o'clock. During our while all of us are talking, please submit questions via chat. We'll be monitoring them throughout, and we'll be asking the questions of the panel at the end. And with that, I'd like to turn things over to Jamie to hear her story as a patient.
Hi, everybody. Thank you so much for joining us today. My name is Jamie Sarver. I'm a LPN, and I also am the program coordinator for the Bariatric and Metabolic Institute. I've been working in this team or with this team for 6 years now. I am a 4 years post-op, and so I like to share my journey specifically with my bariatric surgery and just weight loss in general, in the hopes that it will help other people kind of figure out what they want to do as far as surgery goes. Next slide. So here's just a few pictures of me. The picture on the previous slide was actually my highest weight. That was in September of 2019. And you can see 1 year later, that picture right here on the left with me and my surgeon, Dr. John Rodriguez, just the change in just 1 year. And then each year following, I've also tried to make sure that I make it a point to see him and get a picture, just so that I can kind of use that as a way to kind of track my progress throughout my post-operative course. So next slide. So I'm going to share a little bit about my specific case and my personal kind of reasons and medical history of why I chose to have bariatric surgery. So prior to bariatric surgery, at the time I was 34 years old. My highest weight was 253 pounds. I didn't have any real significant comorbid conditions or diagnoses related to, that were affecting my weight, such as like hypertension or diabetes or anything like that. But I actually had a family history of obesity on my maternal side, and it actually would be exacerbated by the fact that my mother and my grandmother both developed diabetes later in life. And part of that was related to just them being overweight through the majority of their life. And so to me, that was a big kind of push for me that I needed to do something to not develop any kind of issues like that as I get older. So I had also considered bariatric surgery for a lot of years prior to me even working here. I knew that that was something that was out there, but I really didn't have a ton of information on it. I also didn't really know how to even kind of go about getting a bariatric surgical procedure. I didn't know if I would qualify. I didn't know what my insurance would need to be. All of those types of things were things there. I was just like, okay, this is something that I know other people get, but it's a barrier for me because I don't even know where to start on this. I, during that time, had tried numerous years of diet and lifestyle interventions. I had been on medications where sometimes they would work, sometimes they wouldn't, or they would only, partly work, or they would work really great. And then all of a sudden the effects would wear off, or I wouldn't have insurance coverage for them, and I didn't have money to continue paying for them. So I really wasn't able to continue to maintain that weight loss from my prior attempts. So right at the time of surgery, I actually had a gastric bypass. That was the surgery I chose to have. I had that December 13th of 2019. The day before surgery, my weight was 233 pounds. Currently, I hover between 120 and 125. So about 4 years post-operatively, that's, a significant amount of weight that I wound up being able to lose. And then my time in surgery was about an hour and 20 minutes. That's from the time they took me back to the OR and to the time that they took me into recovery. I spent about a day and a half in the hospital. Each person, that can vary. So don't stick to a day and a half. It just kind of depends on how you're doing. And we can talk about that a little bit more in the Q&A if you have questions. And then recovery, it was about 3 days of actually like really needing to stay on top of my pain and stay on top of taking the pain meds consistently, that kind of thing. And then after that, it was really just Tylenol as I felt like I needed it, and just kind of making sure that I was staying on top of the pain so that I could manage some of those other things, like making sure that I'm getting in food and intake and, my fluids, all that kind of stuff. I was up and moving and walking well within 3 days. And when I mean well, I was living in a 4-story house and my room was on the 4th floor. So well was pretty well in terms of I was able to go up and down stairs within the 3 days. And then in 4 weeks, I was back to work. And I really never had any problems since then. I've never had any kind of surgical complications. I've not even had a reason to actually see my bariatric surgeon back in follow-up since the original post-operative appointments. I've just been doing the annual visits with the obesity medicine team. Next slide. So here I kind of like to just show my overall weight. I've been, employee and a patient of this department for a while now, so 6 years essentially. So I have a good representation of my weight over time. And you can see prior to surgery, the left side of the screen, that's where my highest weight was 253 pounds. And then you can see, I did lose a little bit of weight right before surgery. That was part of this 2-week liquid diet that you go on. Plus I knew that I was about to have surgery. So I actually did start some medications and I did start working to really just try to lose as much weight as I could right before I had bariatric surgery, just to kind of help with that weight loss post-operatively. So then you can actually see I had the most rapid amount of weight loss at between the day of surgery and that 6 months post-op, where it really, declined quickly. And then between 6 months and 1 year, you see it kind of starts to slow down a little bit. And then that 1 year to 2 years post-operatively, it really just kind of levels out and you're really kind of maintaining. Your body kind of figures out this is where my new weight's supposed to be. And then you can see later on, I also started working to kind of try to lose a little bit more so that I could get within the actual healthy BMI range. Even though I had bariatric surgery and I had lost a good amount of weight, I was still a little above that. And our employee health plan and things like that, they kind of push for you to continue to work towards getting into a healthy BMI goal. And that was still a goal for me. So I continued to work on that. Next slide. So now I'll just kind of discuss some of those post-op milestones that are really important to just be aware of within the first year of bariatric surgery or post-operatively. So at about 2 to 4 weeks, you're going to be primarily on a liquid diet. You're not really going to be eating anything. And the expectation is that you really shouldn't be able to eat too much. Soft foods are going to be starting to be introduced towards the end of that 2 to 4 weeks. But protein shakes is essentially your main source of nutrition at the time. And so it can be a little bit difficult and a little bit just you get sick of the same thing every single day. Oh, today's a chocolate shake or tomorrow's vanilla, those are your choices. So that's a little difficult, but overall it wasn't terrible. I was also working at that time to make sure that I was reaching at least one of my goals, whether that's the protein goal or whether that's your water intake. The water intake is going to be similar for everybody. It's about, you want to get 64 ounces a day of water in. For protein, it's going to be a little bit different. Each person is going to meet with a dietitian and they're going to do a calculation based off of your height and body weight and give you an ideal number of how many grams of protein you specifically should get. So trying to make sure that you're getting within that amount on either one of those is going to be really important to help you stay away from getting dehydrated or malnourished, anything like that. Another thing that was really important during this time was to get moving, and just knowing that like my surgical pain, like it was starting to kind of like go away. And I really took this time when I was off work to start establishing new routines, and making sure like I'm thinking about what I need to be doing to make sure that I'm taking care of myself. So I was off work, I was able to kind of focus on myself, and that 2 to 4 week period was really important to just start making sure that I'm either taking my vitamins daily, making sure that I'm getting my water in daily, all of those things. I had that time to focus on doing. At 1 to 3 months, I was regularly and consistently hitting my protein and water goals. I was noticeably losing weight, not just to myself, like every day, like you can see like, oh my gosh, my, face looks different, or I'm seeing like my arm, like the size of my arms is changing. It's really rapid weight loss at that time. So you're really seeing a lot of those noticeable weight changes. And then one of the most important things that I was able to see right at that 1 month mark, because I went back to work right at 4 weeks post-op, the activity level was just a complete like night and day change for me. Like I'm a nurse, and I'm used to working the floor. And prior to, I was going home and I was being like, my feet were hurting, my back would hurt. Just going upstairs was terrible. Like all of those types of things. And immediately, like within that 1 month post-op, I was seeing like, I'm not winded just going up the stairs. I'm not, struggling to work on the floor the whole entire day. I'm not coming home, getting out of my car with my feet absolutely like just killing me. Those types of things. I think I actually like at 3 months or like less than that was starting to wear like shoes with heels to work, which I wouldn't have even considered prior to. So those types of changes I noticed immediately. At 3 to 6 months, this is when I like to say that food is finally your friend again, which it's true. So you have some of those like swelling that's internal around your stomach starts going down at like the 3 month post-op mark. And so you're kind of able to eat a little bit more, and you're also able to kind of have a little more variety in what you are eating. So that's when you kind of are starting to like enjoy eating again, as opposed to like, I'm just eating to make sure that I don't get malnourished. The food is finally your friend again at that point, but you are still also really losing weight at a good pace. And so that's really, life-changing when you see like almost every day it's a change in your weight. Almost every week you're down another few pounds, and to go from not being able to be to lose even a pound and doing all of these things and making all of this effort and not even losing a pound, and then all of a sudden you're able to lose 10 pounds in a week or 5 pounds in a week. Everybody's going to be different, but that rapid weight loss really helps you to stay motivated. And then again with the activity level, just that change in your activity in that amount of time. During that time, I like to say I have a wood burning fireplace, and me and my father actually helped to move like 4 truckloads of firewood that year. And there was no way I would have been able to do it. My husband had to work, and so it was me and my dad. And between the two of us, we moved 4 truckloads of wood, and I would have been just dying before that. So I know my activity level improved. At 6 to 12 months post-op, this is when you start slowing down on that weight loss. It's still going, like you still have some weight loss that's going to be achieved. But you can see it kind of starts plateauing a little bit, like I showed on that graph. You are still hitting your protein and water goals daily. This is something that you're going to want to continue to do lifelong, is make sure that you're getting your protein and your water goals on a regular basis. If you don't do that, you kind of know that was you just not thinking about yourself, and not paying attention. Or I'm guilty of that. There's some days where I'm like, oh man, I haven't had enough water today. But you really just know that you can feel those kind of changes that you need to make. You also are having minimal cravings. This is when I really noticed that like my cravings for certain things that I used to have before, like I just wasn't even thinking of that. And so to me, that was something that was super noticeable. Also during this time, by this point, you're actually pretty comfortable with any of the anatomical changes. So you are going to have some, eating and bowel changes and things like that. You're doing a changing of your anatomy. And so there are some changes that you kind of just have to get used to. And you'll know when you maybe ate something you shouldn't, or you maybe overfilled yourself, and what you need to do to kind of compensate for that. The other thing during this time is you really kind of start noticing some of those changes with like your partner, and you also notice like those non-measurable goals. So one of the examples I like to give, my husband was supportive the whole entire time leading up to bariatric surgery. He was fine with me having it. He didn't think that I needed it, which was lovely, but I felt like I needed to do that. And so he was supportive. But after the fact, and he saw my confidence level, and he saw the change that it made me feel, even him, when he would introduce me, or when we would be out in public and we would see somebody we hadn't seen in a while, he would be like, "Look at Jamie, look how good, doesn't she look great? She's lost so much weight." Those types of things. Those really improved my relationship, made it just even more like sweetened the deal, I guess you could say, that my husband, really found value after the fact, when he really didn't initially think that I needed it, or, I was just kind of like doing it. He was going along with it to support me. In the end, he still like looks at it as that was a great choice that you made. And it also helped him to kind of be motivated to work on his own weight issues. And then non-measurable goals, I like to include that because that's important. Just because your scale didn't necessarily move over a week does not mean that those things are not important to look at. So for me, balance was a huge deal. I was able to, like I say, put a sock on while standing, but just being able to do like leg exercises and, all of those types of things that you really weren't able to do before, even painting my toenails and being able to reach my toes was a big deal for me and noticeable. So those non-measurable things are important, and you can see those at that time too. So next slide. So since I'm about 4 years post-op now, I like to kind of talk about like, what do I do to maintain that weight loss? And I look at it as, for me, I took a brief moment of time to make an investment in myself. And so that's what I call it, is an investment in myself. And what am I doing to protect that investment? Because I don't want to have surgery again. I don't want to have to do all of these other things. So what am I doing to make sure that my weight loss is maintained? So some of those things are this. I'm mindful of how much sugar, protein, and water I am getting on a regular basis. Still to this day, 4 years post-op, I look at labels, and I won't put something in my mouth if I know it's going to make me feel sick. So if it has a high amount of sugar in it, I'm careful about that. I'm not saying that I don't eat anything. I mean, I definitely will eat a piece of candy or a piece of cake or a treat or something like that. But I also know that I have to be careful with how much sugar is in those types of things, because I can get a little bit of a side effect from that. I also make sure that I am getting the most amount of protein in every single thing that I eat. So when it comes to my proteins, if I am looking at yogurt selections or cheese selections, things like that, I'm going to be mindful, like, how much does this have versus how much food can I actually eat? If there's only 7 grams of protein in the entire serving, and I know I can only eat half of it, then I'm really only getting 3.5 grams of protein. And is that a worth it meal for me? So I kind of always try to make sure that I'm balancing that out. And then in addition to that, making sure that you're doing the getting your water on a regular basis, especially on days where you're outside more and you're sweating more, all of those types of things. It's important to just make sure you're staying hydrated. Exercise. That is something that we talk about regularly throughout our entire program and throughout your potential journey with us. Our providers are going to say, as soon as you can start exercising, or as much as you can exercise, it's going to be best for you. Including exercise is going to be best. And I will be the first person to admit that I say that to people. And I was the first person in my life that I was like, I don't really need to do this. I'm living the I'm losing weight train from just having a gastric bypass. And I really was rapidly losing weight without doing any real formal exercise. And then at about 6 months, I started plateauing, and I had to kind of look at myself of like, why am I plateauing? Is there something I need to change? I was looking at how much protein, all of those types of things I was getting, and I really didn't see any real changes there. Even though I'm an active person, I was not doing any real exercise. And at that point, I kind of was like, this might be why I'm not losing any more weight. Let me start incorporating exercise into this. And I'm going to show you a slide and it'll prove to you why this is important. But I will tell you, I'm the first person that originally was like, yeah, exercise is important. And I would tell every patient. And then I literally did not do that. And I had to learn my lesson from it. So I like to make sure that I just tell every patient that I talk to now why it's important. Also continuing your daily vitamin regimen. I was on vitamins prior to having bariatric surgery. You're supposed to be on vitamins for the rest of your life, just so that you can maintain your vitamin and nutrition stores. And so just that was not really a change for me. It was just making sure that I'm continuing to take those. And then the next thing that's I feel really important as a person that works in this department with the team that sees post-op patients, as well as just myself, is keeping up with those post-operative appointments. A lot of times my team specifically will see patients that they didn't continue follow-ups or they didn't continue coming in, and they come back a year or 2 years or even 5 years later, and they're sometimes embarrassed because they didn't lose enough weight or they gained their weight back, all of those types of things. And we always try to just encourage patients, it's a lot easier if we notice that you're either slowing down on your weight loss or you've maybe gained 5 to 10 pounds. It's a lot easier for us as a providers to help you make changes at 5 to 10 pounds of weight gain, as opposed to regaining all your weight. And now we got to kind of figure out like a new plan for you. So keeping up with those post-op appointments is going to help you to maintain your weight loss and that investment in yourself. So this next slide is going to show you why exercise is so important. So here you can see the summer of 2020, I was about 6 months post-op, and I was definitely riding that like, I'm losing weight, this is fine. My highest weight was 253 pounds. So I was almost 100 pounds down. So I was so happy and thrilled, but I was still 165 to 170 pounds, and I wasn't really losing anymore. But I also, you can see I wasn't really super toned. And so then I started incorporating exercising and doing weight training, that kind of stuff. And you can see in summer of 2021, I was still kind of similar weight. I had lost a little bit more weight, but you can also see that I actually have muscles. And I also have like tone in my body that I mean, even exercising just in general, prior to having surgery, I would exercise regularly and not even see any change whatsoever. And now it's continued to motivate me in that I can exercise and I actually see the effects of the exercise and see how this works. And I also try to just make sure I tell people, like, I've not even been a member of a gym. I don't pay for a gym membership. I have free weights at home, and I have a rower that I actually had before I was even, that used to have clothes on it. And so before I even had surgery, that's what I was using, or when I would exercise. But now this is me after incorporating weight training and some cardio, but mostly weight resistance training. And it really helped me to continue to lose weight, as well as help with the diminish the sagging skin and like those types of things that people get concerned about. So I always say this is the proof in the pudding of why it's important to exercise after surgery. Next slide. Okay, I think that's it. So Dr. Gutnick will talk about the effectiveness of surgery, and I hope you enjoyed my presentation, and thank you again for joining me, and I'm here for any questions that you have.
Yeah, thank you so much, Jamie. I love that last picture. I think that summarizes this whole presentation in one slide. So I'm going to talk a little bit about how bariatric surgery works. So the reason that it works is it basically changes your body's mechanisms that maintain your weight or even promote weight gain. And the comparison we usually use is the concept of a thermostat. So just like the thermostat that's on your air conditioning or heating system, it's designed to keep your house at a certain temperature. The temperature goes up, your AC kicks on, and it brings you down. Where that comes into play is when you diet, then your body changes its hormonal balances to fight that weight loss, because it doesn't know the difference between dieting and you being in some extreme condition where you don't have any access to food. So it tries to fight the weight loss. And weight loss surgery essentially reprograms how your body manages the nutrients and resets that thermostat to a lower level. Some of the mechanisms that work on this are the first one's your basal energy expenditure. This is how much energy that your body burns when you're not doing a heavy exercise, like I am right now sitting talking to you. How much is my body spending? So when you diet, your body down regulates that to try to preserve your weight. After weight loss surgery, that basal energy expenditure goes up. Similarly, when you're dieting, your appetite increases to try to promote more food intake to maintain your weight. Your sense of fullness goes down. Your stress hormone levels go up when you're dieting. They go down after bariatric surgery. And then there's specific gut hormones and other things like ghrelin, peptides, bile acids that actually are the hormones that change these other things that we talked about earlier, like your energy expenditure. So in summary, it changes your thermostat. Your surgical options are sleeve gastrectomy, gastric bypass, duodenal switch, and SADIA or revisional surgery in less common situations. The most common operations we do are gastric bypass and sleeve gastrectomy. You may be familiar with these pictures. Gastric bypass is literally a stomach bypass where a small pouch is made on the top of your stomach, and that's directly connected to the small intestine. That's the operation that Jamie, who gave our earlier presentation, had. The other one that is sleeve gastrectomy. These comprise about 90% of the operations that are done in our practice for weight loss. So there's a lot of trials that back this up. In particular, not just showing the weight loss, but the effect on other health outcomes, in particular diabetes. Now, diabetes is frequently studied when it comes to weight loss and weight loss surgery for two reasons. One, because it's a really important thing to treat because it has so many bad effects on your health. Number two, it's also somewhat easy to study because there's certain types of lab tests like your A1C, which you're familiar with if you have diabetes or have a family member who has it, that you can measure over time. And so it's both important to patients and it's also straightforward to measure in some ways. And so in addition to the weight loss, we had a randomized controlled trial and the results are still following up many, many years later, comparing the best medical treatment of diabetes with people who underwent gastric bypass and sleeve gastrectomy. So this graph shows over time people's change in their BMI after they were randomized either medical treatment or surgery. And as you can see in yellow, that's the medical treatment. And those people did have a weight loss over time, and that weight loss was sustained. It was just a couple of BMI points. If you compare that to gastric bypass and sleeve gastrectomy, for gastric bypass, over 10 BMI points change, and that was sustained over time. But even more impressively, the diabetes A1C, which is that laboratory value that measures how your sugars are controlled, were significantly better, and they maintained this over many years. This also improved in the people with the best medical therapy, but nowhere to the same degree. So just like with diabetes, in addition to the weight loss, these improvements are seen in all the other health conditions that are related to obesity. Common ones would be asthma, high blood pressure, heartburn, arthritis, etc. And the goal with surgery is to hopefully intervene before you have these and to prevent it, but to stabilize or even in most people reverse these problems. And with that, I'm going to pass it over to Dr. Wilson, who's actually going to do this next session. I wasn't sure if she was able to join from the operating room when we first said, so I hadn't changed her name over. I'm going to turn that over to you, Rickesha.
Thanks so much, Jesse, and good to be with everyone this afternoon. I'll talk about safety of weight loss surgery, and this is, of course, the most important question that we get, and it's what is on everyone's mind. How safe is surgery? And we've come such a long way from maybe the last 3 decades of doing metabolic or weight loss surgery. More commonly, it's very safe. And so how do you measure safety? So you want to compare surgery to doing non-surgical or medical therapy for obesity or obesity related conditions. And so we want the risk to be as small as possible. Okay. And then the benefit, we want that to be as large as possible over time. So that's kind of those are some important things to think about when thinking about safety. Next slide. Safety in bariatric surgery, we've been able to measure it starting in the early 2000s when we really started to track. In terms of mortality, I mean, that's the ultimate safety measure. It went from 4 out of 1,000, so 0.4%, now to 0.06%. That was back in 2009. And so mortality and the safety mortality has been decreasing, or the risk of death has decreased dramatically. In this study, this is about 100,000 patients, but our data, including thousands and thousands of more patients now up to this point, show that we're still very safe. Next slide. So today, the mortality is about 0.8 out of 1,000, and it's very rare. And everybody is also different in terms of their risk profile. We do metabolic or weight loss surgery for more than just weight loss. Some of our patients are very sick and they might need to qualify for a transplant of an organ. Some people need a heart or a kidney, a liver, and they have to get their weight down to be healthy enough. So everybody carries a different risk. So the low mortality is real, and we're always striving to make surgery as safe as possible. So next slide. And it's important to compare this surgery to other common surgeries that you may have had, or friends or family that you have may have had. And so in this graph at the very bottom is the Roux-en-Y gastric bypass. And this study measured about 67,000 patients with diabetes, and 16,000 of those patients underwent a gastric bypass. So a large number of patients were tracked, and the complication rate for a bypass was 3.4%. And that was comparable to getting your gallbladder removed, having a hysterectomy, or getting your uterus removed. And those complication, that rate is lower than getting your appendix out, part of your colon, joint surgery like a knee arthroplasty. If you know anyone who's had a CABG or a bypass on their heart, that complication rate is very high. So this gives you some perspective about how safe weight loss surgery is compared to multiple procedures that are commonly done today. And diabetes puts these patients at a higher risk group, so the complication rate is still low. And so I think that can be comforting to those of you who really wonder about the safety of this surgery. Next slide. And we've also done more studies. This study that was published in a really popular medical journal, but was also covered by many media outlets, compared patients with diabetes and obesity, and compared over 2,000 of those patients who underwent bariatric surgery, compared to about over 11,000 patients who did not undergo surgery for weight loss or diabetes improvement. And comparing these two groups of patients, we were able to evaluate their cardiovascular outcomes, or the risk related to heart-related diseases and conditions over about a 20-year period. Next slide. So and these cardiovascular events included coronary disease, or disease of the vessels to the heart, heart failure, abnormal heart rhythms, stroke, high blood pressure, kidney disease. And so what we found is, in the group that had undergone bariatric surgery, over the long term, this is years, out up to 8 years, we found that there was a much lower risk of adverse events or cardiac events over the years compared to those who did not get their obesity and diabetes treated or addressed with bariatric surgery. And so you have not only maybe lost weight, improved your medical conditions, but over time, these things can extend your life. Having cardiac disease or coronary artery disease, stroke, heart failure, these are life-threatening conditions that are related to obesity. And so not only is the surgery safe and you'll get through it at the time of surgery, but in the years to come, it will help prevent or lower your risk of developing other diseases that are related to obesity. Next slide. And so how do you get longer life after surgery? How does surgery benefit your safety in the long run? With significant weight loss, we know that sleep apnea improves. Many people are coming off of their CPAP machines. Diabetes improvement. Many people want to get off their insulin. They're off multiple medications. There have been positive impacts on fertility. People who may have what you may have heard of as polycystic ovarian syndrome or PCOS, making it difficult to have kids. Some people are finding that with a healthier lifestyle after surgery and what that affords them, they can do that. Many people have back pain, knee pain, joint pain related to obesity that can improve. The risk of certain cancers that are related to obesity, such as endometrial uterine cancer, certain types of breast cancer as well, treating fatty liver disease and more. Surgery makes things safer, makes you safer overall in your overall health in the long term. Next slide. Thanks so much for y'all's time and attention. And I'll hand it over to my colleague, Karen Schulz.
Hello, everyone.
And as you start, Karen, I'm just going to put a quick request into our participants to please send in some more questions as we're going through these topics so that we can have some good questions answered at the end.
All right. Yeah, I can just type them right in the chat as I'm talking. So my name is Karen, and I am the program administrator and also one of the providers on our obesity medicine team. I'm just going to take a couple minutes here to tell you a little bit about the program and what it's like to be a patient at the Cleveland Clinic Bariatric and Metabolic Institute. Next slide. So one of the newer features of our program is we have been able to do most of our visits now, all or most of the preoperative visits virtually. We love to see you in person. That's always our favorite. But if we also understand that your time is valuable and that everyone's working, so you could definitely do the visits virtually if you would like. We also have lots of access. So we are in many locations, as you can see here, centrally at main campus. We are on the west side, Fairview, Avon, actually Lutheran, and we're soon to add a Westlake office. And on the east side, then Hillcrest, Twinsburg, and Mentor. Now we do surgery at main campus, Fairview, Lutheran, and Hillcrest. The other sites are outpatient for your preoperative visits, or as I mentioned, also in the comfort of your own home. Next slide. All right, so we really appreciate you considering the Cleveland Clinic for potentially having bariatric surgery. You know, you have lots of choices. This is what U.S. News and World Report says about the Cleveland Clinic Digestive Disease Institute, which is where the Bariatric and Metabolic Institute lies. So lots of great ratings, but also we have an awesome team. So we're a big program. We do a lot of surgery, but you have your own team. We have, we'll talk a little bit more individually about what they do, but we have 12 bariatric surgeons, 7 dietitians, 7 psychologists, and we have 3 obesity medicine physicians and another 5 nurse practitioners that will be part of your care here at the Cleveland Clinic. Next slide. All right, and in addition to the team, which we'll talk about in a minute, each patient has a navigator. So that navigator is going to work closely with your insurance company to make sure that you get the approval that you need, so you don't have any financial worries. They also help coordinate your appointments. They ensure that not only do you know if you have insurance, but also that all the requirements of your insurance company are met. And they are available every Tuesday in person for a webinar very much like this, where you can meet and chat with them, as well as by telephone or email. So we really try to help each person get through that preoperative process with a navigator. On the next slide, we talk a little bit about the specialist teams. So I mentioned the extensive team that we have. We really want to make sure that before you become the owner of a bariatric operation, that you're completely comfortable with what you're going to be eating and when you're going to be eating it, what types of foods are best. So as Jamie mentioned, going into the program, lots of instruction by one of our dietitians. She'll have one dietitian assigned to you. You'll have an obesity medicine provider, and that individual's job is to make sure you're absolutely as healthy as possible going into the operation. So you don't have to have a perfect health profile. We have lots of patients with diabetes, high blood pressure, sleep apnea, serious cardiac conditions. We even have people that need organ transplant. As long as your health conditions are in the best control possible, we can safely get you through that operation. And that's what obesity medicine does in conjunction with the physicians that you may already have on your health team. And then we have the bariatric psychologists, and each patient is assigned a psychologist to help them mentally prepare for the operation. So again, you don't have to be in perfect emotional and psychological condition. We have lots of folks with anxiety, depression. We work with your providers to make sure that you're in the best situation possible. And finally, of course, the bariatric surgeon, who you'll meet with usually one time in preparation for making that surgical decision, once right before surgery and then afterwards. And then a variety of consultants. Depending on what health conditions you have, we have every specialty you can imagine at the Cleveland Clinic, including sleep medicine, cardiology, endocrinology. So full complement of providers. Next slide. All right, now we go into our question and answer time period. I'm going to have Dr. Gutnick be our moderator.
Yeah, thank you everybody for sending. I saw a whole bunch more questions, so thank you for sending them in. So just to give you a reminder, I'm going to be monitoring this, and then we'll see if we can get Dr. Wilson for a couple of questions. She had to get back to the operating room. But in the meantime, remember to submit all our questions to the chat function. And one of the first questions I want to just address, because it was sent in, was what are the next steps? I'm going to leave these next steps up here so that you have that information. Dr. Wilson, are you still with us, or did you have to get back to the operating room?
She did text that she was going back to the OR.
Gotcha. All right. Well, I will send these questions to you guys then and answer some myself. So, Karen, so first off, actually, I'll say, Jamie, I'm sure you saw this, but there are tons of people giving you great kudos for your presentation. So hopefully you saw those too.
Yes.
Karen, some people, one person asked, I'm already being followed by a medical obesity treatment provider. I think they meant the endocrinology department. Would they be able to keep working with that person along with learning more about bariatric surgery if they wanted to, or how does that interplay work?
Yeah, absolutely. We work with a lot of the team over in endocrinology. I think as far as the bariatric visit, would just make it easier from a clearance standpoint, because we would have probably everything we need already, or close to everything. And it would just be more of a quick check-in with our obesity medicine team rather than a longer visit and series of testing. So those of you who are really in touch with your medical providers and have had recent evaluations, we can usually use all of that in our preoperative evaluation.
Yeah, and then Jamie, can you talk a little bit about? There's several questions about insurance. How does somebody find out if their insurance covers them or not, and maybe what the requirements are, to be covered?
Sure. So In most cases, bariatric surgery is indicated for anybody with a BMI of 35 or higher. And, your insurance can vary depending on what insurance company you have. So sometimes you'll need to have some of those comorbid conditions that I talked about. So diabetes, obstructive sleep apnea, sometimes stuff like that is needed. Other times it's not. And you might also have a certain number of visits with a dietitian that you have to meet. All of those types of things are going to be on an individual basis. But the most important thing to know in order to kind of find that information out is just if you actually take those next steps and you go to the clevelandclinicweightloss.com and you complete that health questionnaire and include your insurance information, part of our navigation team's role is they're going to contact your insurance company specifically and find out what insurance benefits you specifically have and if you have coverage. And then they're going to send a welcome letter back to you, just kind of indicating, hey, this is what your insurance told us that is a requirement. It's also still a good idea for you to contact your insurance company directly, just so that you can make sure that they're telling you the same thing. Because we have in the past had patients where the insurance company told them one thing and the insurance company told us another thing. So as long as you are in communication with your navigator, the navigation team will actually look to see if you have insurance coverage and then get back to you and let you know. And then following that, we will call you to schedule those appointments if you have insurance coverage.
Thanks. I'm going to take the next one. I'm going to sort of summarize this question. This person's had some prior abdominal surgery. It sounds like it was extensive, and what kind of options would be available. So, I guess the answer would be, in general, even in people who've had some prior abdominal surgery, we can typically do a weight loss operation minimally invasively. It obviously depends on exactly what you had. And so the most important thing about your first visit with your surgeon is going over that type of information and specifically, hopefully we're being able to review the operative notes from your prior surgeries so that we can, number one, give you an idea of what operations might be feasible minimally invasively, or you may need an open bariatric operation. Those are relatively unusual. I'd probably do 1 or 2 per year, but they do occasionally happen. I've got one scheduled later on this month, and someone who did prior have an episode of sepsis like the person asked the question. And like I said, we do a couple a year, but most people are able to be done laparoscopically. Karen, one person asked, I double checked with my insurance company and they don't have coverage. Are there options to pay out of pocket?
All right, tough time right now for that question. We are currently re-evaluating our self-pay package, so we do not have one right now, but we do expect to have one early next year. There is a financial counselor available to talk to anybody, but we are currently without something I can actually tell you as far as a price.
And Karen, I know we went over it, but where do we have, some people asked where we had offices, so where are we able to see patients?
Okay, so for the east side, we are at the Cleveland Clinic Twinsburg office. And I don't know what street that's on. I don't know if you guys know, but actually at the new Mentor campus, we have offices. That's also on the east side. Main campus right at the, on Euclid Avenue. Then on the west side, we're at the Lutheran Outpatient Clinic, which is on Fulton Road. The west side, we're at our Richard E. Jacobs in Avon. Some of our providers actually see people at Fairview Hospital. And then we're working on a Westlake office on Clements Road that will be open next year. Did I miss any?
Well, and I'll say that most importantly, we have extensive virtual visits available. Right. Half of my office schedule is not in the office, but is virtual, as is almost everybody's. So even if you're coming from far away, we're able to see you. I would also add that we do see some people through other products. Speaking of insurance coverage, we also do see people through some other products for where their employer chooses to cover bariatric surgery through these specific products. They're an add-on to their insurance, such as Carum. So you may want to check with your employer, even if you don't have coverage, if they have that type of option.
Yeah. The other thing I want to say, Dr. Gutnick, because we can also do combinations. So some people will do a couple in person or one in person and the rest virtual. So we can mix it up.
Also, I was going to add to that, the importance of in-person is sometimes there's material that we can give you that's better to get in person. So like we have a guide to surgery book. The patients that have virtual appointments only sometimes miss out on that opportunity to get the hard copy, which is always helpful, as opposed to just getting that like PDF link to look at, and maybe you have to print it out yourself. But there are some benefits to coming in person.
Gotcha. Jamie, this person jumped on late, so they had some questions about what we need to do for vitamin deficiencies in there of females. So they said in particular for a woman, but I think this is true for men as well.
Yeah, actually, that's an important concern for me as I get into my early 40s and will be having to worry about, some of those changes. So really, there are specific vitamins that, like specific amounts of certain vitamins that we actually will provide you the actual. This is your daily requirement for vitamin D. This is your daily requirement for vitamin B. We will let you know. That's actually in our guide to surgery books. That's in a lot of like the paperwork and patient resources that we offer. But there's really, it's just there are vitamins that you should take on a daily basis. And there's a lot of companies that make specifically formulated vitamins for post-bariatric surgery patients that contain those specific amounts that you would need. I actually keep a little thing right on my desk so that I can continue to take my little chew every single day, and it reminds me to just kind of take that. But there are vitamins available. And then another thing that's important, like I mentioned before, is going to your annual post-op appointments. We at our institute encourage lifelong participation, you to come back every single year so that we can make sure that you're doing good, not only with maintaining that weight loss, but we also are going to do some lab checks that include those vitamin and nutrients that you might be missing or things like that. So that's why it's important to have those annual follow-ups, so that if you are depleted in certain stores of, vitamin D or something like that, we're able to check that at least once yearly and make sure that we're getting you back on track, as opposed to you have like a solid 10 years of being lacking in vitamin D, and then you have all these other problems associated with, poor vitamin intake. So that's how I manage it.
I'm going to answer the next one. Someone asked, is the process different if I'm looking into revisional surgery? The answer is definitely yes. There's two types of revisional surgery. The first one, and the more straightforward one, is if you're suffering from a problem or a complication or an issue from a prior surgery. That's generally very straightforward. You meet with a surgeon and you figure out what that problem is and what the solution is, and then you do it. Because you're treating a problem. If you're looking at revisional surgery for weight regain, or you want to enhance your weight loss, that can be it may be less complicated from a technical perspective, but it's maybe more complicated from an insurance perspective. And we have to just see individually what you have coverage for and what the insurance company's requirements for are. There's a couple other, we were getting more than typical insurance questions today. Someone is asking if they have the employee health plan. So that's someone that has their insurance by being an employee or a family member of an employee for Cleveland Clinic. Are there, Karen, do you have to wait 2 years, or how does that process work?
You have to be employed for 2 years prior to starting the process. That's what the 2 years is about. Yeah. And then you can
on the insurance for 2 years.
Yeah, on the insurance
health plan insurance for 2 years.
Right. That's right.
Yeah, and they're quite specific about that. So I would recommend to that person just wait until you've been employed for 2 years, and then call us on 2 years and a day, and we'll be happy to take care of you. And also be in touch with your coordinator for the insurance plan. Karen, I'm going to send this next question to you too. I'm worried about losing my muscle mass. What can I do to mitigate this or decrease that risk with surgery?
Yeah, I think a lot of people are concerned about where they're going to lose weight and try to target the fat and not the muscle. Of course, losing a little bit of muscle is going to happen, but we really focus on getting your protein first in your diet. I think that's one of the most important things initially, is to make sure you're getting. We'll tell you exactly how many grams of protein. It's going to be between 70 and 90 probably for most people, so that you're eating the right things to maintain as much muscle mass as possible. I think also physical activity, which Jamie was great at, is really important to preserve the muscle mass and reduce as much of the fatty tissue as possible. But it's not always the perfect body that you might have. Imagine all the exercise in the world. Sometimes there might be a little extra skin, and we usually get that question. And it's impossible to know how much extra skin you're going to have until you get to the end, really, of your weight loss. And if there is a troublesome area of skin, it's usually the exception to the most common scenario. But we do have plastic surgeons that are available that can help if all of that skin does not shrink with you as you're losing weight.
I'm going to take this next one. This person's had, it sounds like, quite the cardiovascular history. They've had heart attacks and blood clots. Are you disqualified from surgery? I'm going to say the answer is probably not. I mean, obviously, we need to evaluate your personal history, but we frequently care for people that have heart disease and or blood clots and have anticoagulation. We just need to get you as optimized as possible with your heart and vascular doctors to make sure you're as safe as possible for surgery. So you might require some more tuning up, as it were, but that definitely does not exclude you by any means. Even in certain circumstances, we've done surgery fairly frequently to get people safe for a heart transplant. So that's even been done in the past. So I don't think it excludes you. Jamie, can you explain, and maybe we don't know the entire answer to this, to be honest, but why do some people have hair changes or lose their hair during the weight loss process? And I'll just say that to everybody who's out there, I'm not an example of what can happen to you. This is all hereditary. So
yeah,
what do we know about that?
so it's not fully known why certain people lose their hair. There's a couple different reasons for it. So sometimes it can be just the effect post-operatively, just having bariatric surgery. Sometimes it can be related to hair loss can happen actually from decreased amount of protein intake. Sometimes it can happen from changes in your vitamin levels, those types of things. So not every patient are we going to be able to say specifically like, oh, it was exactly attributed to this. But what we are able to do is just kind of like minimize the potential for you to, lose your hair. And even myself, my hair thinned. It's not like you have, bald patches or the top of your head goes bald and then the one side's growing. It's very scattered. It's very just, my hair tended to thin. And that was in between that 3 and 6 months post-operatively. And that really is where I was not able to, I was relying mostly on protein shakes. I was starting to take vitamins, but I had also just had a major surgery. There was a lot of different variables at that time, but like literally at the 6 month mark, it really stopped. I stopped losing hair and I started growing it. So actually it was funny for I think between 6 and 9 months post-op, I had this little halo of little baby hairs around my head every time I blow dried my hair, because my hair was finally starting to come back in and get thicker and stuff like that. And I really haven't worried about hair loss since. It's again, just varied, but you want to make sure that you do your best to eliminate those things that can cause hair loss, which is the low vitamin D levels, the low vitamins just in general, the lack of getting protein, and then just making sure that you're kind of preparing yourself prior to bariatric surgery, doing the steps that we are asking, right before surgery, making sure that you're properly fluid, you've got enough fluid and carbohydrates and things like that before you have bariatric surgery, just to kind of limit that shock to your body, essentially.
Yeah, so I think one of the main things is that, your hair is made out of protein. Your body considers your hair the most expendable protein on your body, much more so than everything else that you make up, like your the proteins in your blood, your muscles, your skin, etc. So most frequently when we see somebody that has more than typical or even any at all, they are often struggling with getting their protein in, and that's the most important thing. Let's see. Now, here's a question: How do we get a navigator, Karen? How does somebody get the navigator?
Yeah, and that kind of goes to the next steps that's up on the screen. So after watching an online seminar, which is recommended but not required, there's either a seminar or there's something that says register here. But you'll be clicking on take the first step. That's on our website. Watch a seminar, fill out the registration. And then the next day after you do that, we're going to be doing an insurance check. We do ask for your insurance information. So when you go to register, make sure you have your card and your group number there. We do that the next day, but give us a little bit more time, usually by a week at tops later. If you have coverage, we will be reaching out to schedule an appointment. If you do not have coverage, or we need some medical records first, and I see a few questions about people not sure they did the seminar and they didn't hear anything. Check your email, because we may email you a message that we need a record, or maybe some more questions about your insurance. And there's also a possibility that maybe the registration didn't go all the way through. So you could also call us. This the main line, and I could say it's 216-445-2224. If you have difficulty and you're not hearing back, or you're unable to get a hold of someone, the navigator will be sent out. It will be assigned to you automatically, so you don't have to do anything to get a navigator. They're assigned by the alphabet, and you'll know who your navigator is when you get that welcome email. Okay, and in that email, it's going to say if you have coverage. It might say if you don't have coverage. So definitely want to keep an eye on your email if you register if and when you register for the program, because that's how we make that initial contact with you.
Yeah, and I'm going to directly answer the next question. Kim had asked, she wanted to confirm what the situation is with our out-of-pocket option. We, for a long time, had an out-of-pocket option, and we will in the future. We're currently revamping it, and so by the beginning of next year, we should be able to give you more details. You can still touch base with our financial counselor about that, though, in the meantime, and you can do that by sending in the registering in the same way, or calling our main line.
Right.
Now, let me scroll back through to make sure I didn't miss any. Did you guys notice any questions that I had not gone over yet? Oh, Jamie, can you turn your
Sorry, I realized I'm muted. I noticed one that was about how invasive is the sleeve versus the bypass. They went septic a few years back and have scar tissue. And so there was a concern as far as scar tissue and what the difference is between the different, how you pick surgeries versus pros and cons of the different ones. So I don't know if you want to comment on that, Dr. Gutnick.
Yeah, so I can tell you exactly how I approach this with the patients that I see. And the first question that I ask people, well, the first thing I do is ask if the patient has any questions for me. Often people do come in having done a lot of research. You're not required to do this by any means, but often people have come in with having done a lot of research and have a lot of questions for me, and I try to get to those first. The second question I ask is if you've had prior abdominal surgery, because most people, even if they've had prior abdominal surgery, still have good minimally invasive options. It's the exception that they don't. But about once or usually a couple times a year, I do an open bariatric operation for people who've had extensive prior abdominal surgery. I've got one coming up later, actually at the end of the month in a couple of weeks, and that's always an option. But the majority of people will have a good option that's minimally invasive. So for most people, the operation involves 5 incisions, sometimes 4. In particular, if your weight starts lower and or if your liver shrinks really well on our preoperative diet, occasionally it's just 4 small incisions. So in terms of invasiveness, it's a similar level of pain for most people to a gallbladder operation if you've had one of those, or if you know someone who's had those, where you're mostly taking Tylenol. You might need 1 or 2 prescription pain pills. What some people mean by invasiveness is not the surgery itself, and actually, to me, actually, the more relevant as a physician and as somebody who takes care of patients, the more relevant question, even though it's not always the question people want to know the answer to, is what's it like living with the operation, 6 months down the road, 1 year down the road, 5 years down the road. And I actually focus a lot of my counseling on their health goals, their weight loss goals, and trying to fit the operation to those types of things and the side effects they would want to look at or not look at, dealing with or working with over time. And so people often ask about invasiveness, but I tend to try to focus the procedure choice on those things. And I think, Jamie, you're a good example of that. You had mentioned, that the operation that you had, which is gastric bypass, you do need to watch out for eating sugary foods because they can give you symptoms if you have more than a little bit of that. And that is helpful to a lot of patients, but also you need to watch out for it. And so that would be one thing I'd talk to people about, for example.
Yeah, I was going to comment and say, just follow up to you and say that was, for me, one of those decision maker breaker kind of things for me was I know that I wanted the most long-term effect, cause and effect of helping me to maintain my weight loss. And I knew with the gastric bypass, you have a longer prevalence of getting dumping syndrome after eating simple carbohydrates and sugars and things like that. And so for me, I felt like I need that like visceral reminder of like you put something in your mouth that was not healthy, was not something that you should be continuing to eat. And so you either A, need to eat only a small amount of it, or B, you ate too much and now you're going to feel sick and ill. And so that really helped me to, even still to this day, I will experience getting sick or feeling sick or not feeling well, having like a stomach ache from eating too much sugar at one time, or even sometimes it's something as simple as, eating crackers or mashed potatoes. So those all break down into simple sugars inside your body, and those can cause that dumping syndrome that we've kind of been talking about.
Yeah. And that's something that's in particular to the gastric bypass. The other, two main options, the sleeve gastrectomy and the duodenal switch, you don't necessarily get the dumping syndrome, but you need to watch other things in your diet because they'll affect you with other things. So it's all about the trade-offs. I think since we're beyond the 5 o'clock, I want to just get in one last question that was answered because I think it's a really important one. The question is, if you need your gallbladder removed, can it be done at the same time? The answer is, of course, yes. It is straightforward to do it at the same time. But I'll also say, if you haven't even met with us yet, but you think you need your gallbladder removed, you shouldn't wait. You should just, if it's giving you problems or pain, it can just be taken care of right away. Occasionally, people will develop a gallbladder problem while they're undergoing the workup, and we just plan on doing it at the same time. But if it really is, your gallbladder really is bothering you, you can just get it taken care of ahead of time, and we can, if we're already seeing you, we can just take care of that, or any of us surgeons are happy to see you and help you take care of that. And with that, a big thank you to the panel for having your early evening with us. Thank you for all the people here that joined us for learning more about weight loss surgery. I hope everybody has a good evening and some good holidays coming up. So thank you.
Bye. Thank you, everybody.